Hello, I'm Dr. Siraj Ibrahim, consultant physician at the Garissa County Referral Hospital. Today we'll be talking about microvascular complications of diabetes. Diabetes is a chronic disease that occurs when there is high blood glucose in your body. As per the IDF 2025 guidelines, 1 in 9 adults live with diabetes. There are various forms of diabetes, but the two most common types of diabetes are diabetes type 1 and diabetes type 2 in our setup. The complications of diabetes are mainly classified as microvascular and macrovascular complications of diabetes. Microvascular complications of diabetes occurs when there is damage to the blood vessels in the body. The three main types are diabetic retinopathy, diabetic nephropathy, and diabetic neuropathy. The risk of developing these complications are mainly based on 1, the severity of diabetes, and 2, the duration of diabetes. Diabetic retinopathy occurs when there is damage to the retina of the eye. This will present either as diminished vision or, in worst case scenario, total loss of vision. Diabetic retinopathy is the most common complication of microvascular complication of diabetes. This is followed by diabetic nephropathy. Diabetic nephropathy occurs when there is damage to the nephrons in the kidney. And diabetic nephropathy is the most common cause of kidney failure worldwide. Diabetic kidney disease, or diabetic nephropathy as it's also called, is a slowly progressive disease, and in most of the time you might not realize that you have this disease till in the later stages. This early enough will present either as generalized fatigue and body pains, or in the later stages with reduction in the volume of the urine, or in severe cases total absence of urine, and also abdominal pains with associated vomiting and generalized body pains. Being a slowly progressive disease, most of the patients might not realize that they have developed this disease. Hence, the need to screen early enough these complications. The last but not the least of these complications are diabetic neuropathy, and this occurs when there is damage to the neurons in the body. This will present as tingling and burning sensation in the hands and the feet, and in other times as shooting pains mainly felt in the legs. When the nerves in the other parts of the body is affected, this might also present as nausea, vomiting, diarrhea, and constipation. Also with dizziness and lightheadedness and loss of sexual function. Other minor types of microvascular complications of diabetes are brain atrophy, dementia, muscle atrophy, and loss of sexual function. The risk of developing these complications is mainly based on the duration of diabetes and the severity of diabetes. Hence, these complications can be present at the time of diagnosis or as the disease progresses. Hence, the need to screen this at the time of diagnosis and yearly thereafter, so that you're able to pick up these complications early enough and treat them. The good news is that these complications can be delayed or in totality prevented with lifestyle modifications such as regular exercise, eating a balanced diet, quitting smoking, maintaining your blood glucose within the recommended target, and also maintaining your blood pressure and your blood cholesterol within the recommended targets. We also advise that the patients keep track of their blood, the level of their blood glucose, but by doing daily blood glucose monitoring and having contact with either their physician or their general practitioner, whichever is available at their place. Thank you very much.